ಪಾದಕಮಲಗಳಿಗೆ ಅತ್ಯಂತ ಶ್ರದ್ಧಾಪೂರ್ವಕವಾದಂಥ ನನ್ನ ನಮನಗಳನ್ನು ಅರ್ಪಿಸ್ತಾರೆ. ಅದೇ ರೀತಿ ನಮ್ಮ ಹಿರಿಯರು ಈ ಸಂಸ್ಥೆಯನ್ನ ವಿಶ್ವಕ್ಕೆ ಪರಿಚಯ, ವಿಶ್ವ ಮಟ್ಟಕ್ಕೆ ಎತ್ತರಕ್ಕೆ ತೆಗೆದುಕೊಂಡು ಹೋಗ್ತಾ ಇರೋದರಲ್ಲಿ ಸ್ವಾಮೀಜಿಯವರ ಹೆಗಲಿಗೆ ಹೆಗಲು ಕೊಟ್ಟು ಕೆಲಸ ಮಾಡ್ತಾ ಇರ್ತಕ್ಕಂಥ ನರಸಿಂಹಣ್ಣನವರು ಮತ್ತು ವೇದಿಕೆ ಮೇಲೆ ಉಪಸ್ಥಿತರಿರುವ ಎಲ್ಲ ಗಣ್ಯಾತಿ ಗಣ್ಯರೇ, ದೇಶ ವಿದೇಶಗಳಿಂದ ಬಂದಿರತಕ್ಕಂಥ ಎಲ್ಲ ಸಹೋದರ ಸಹೋದರಿಯರು, since I was told that there are participants from over 22 countries, so I would like to say my few words in English. This is very close to my heart. I am also a medical graduate, but I did not become a medical graduate so easily. So, to begin with, I would like to share my story. I have shared few times, but the audience being a new audience, I think I will repeat my story. I am a son of a small farmer and a school teacher who is a school teacher. After I finished my 12th standard, I had a passion of becoming a doctor. Those days we had only two professions that we knew. One is doctors and another one is engineers. So we didn't know the third. Those who don't get medicine and engineering, they would go to arts and other studies. So as soon as I completed my 12th standard, though I paid for my competitive exams, then I could not get through. And that time the management fees was high. I still remember it was about 3 lakh or so, which we could not afford. Today's the scenario is different. Some students, some parents come up to me and they say now, even for a graduation, that is MBBS, it costs more than 80 lakhs, 1 crore, and some institutions cost, in some institutions, 1.2 crores, those who do not get the government seats. So 1 year I had to stay back at home without going to pursue because I was so bent upon studying medical education only. So then my dad decided that to sell 1 acre of the grape land that we had. He got me the admission. For medical graduation in Tumkur, Siddhartha Institute of Medical Sciences. Why I say that? Today the scenario is not different from what I witnessed about 26-27 years ago. But the medical education has been a very, very important platforms or the backbone of this country to provide the secondary and tertiary health care. Our Honorable Prime Minister, I should acknowledge and congratulate to have understood this issue. When he became the Prime Minister from 2014 till date, he has added at least more than 200 medical colleges in the country today. the government medical colleges I'm talking about. Today, the annual admissions for medical graduation is close to 1 lakh in a year, in the entire country, 1 lakh students. How many students appear for the competitive exams to get into medical education? 1.5 million students. That is 15 lakh. Out of which, about 40,000 students will get the government seats, where the fees are completely, very low, subsidized by the government, and it is in the government institutions. So only 40,000 get, and the remaining 60,000 are available in the private institutions. And these courses that are available in the private sector, it is exorbitantly very high. None of the students from the middle class or the lower middle class can even dream of studying medical education today. Apart from this 1 lakh students that get entry into the medical college system, apart from that, another 20 to 30,000 students, Indian students, go abroad, China, Russia, Ukraine. These are the countries they go, because they feel that the fees are less compared to that is available in India. If you have observed in Ukraine, during this war, more than 600 students from Karnataka alone, they came back. I've had extensive one round of meeting with them. We are studying the modalities, methods of how we can help. Because we have an NMC, which is the governing and regulatory body in the government at the center, who regulates the entire medical education in India. So, the post-graduation seats were also increased by 78% by our Honorable Prime Minister. He came up with an idea that there should be one medical college in every district across the country. So each district, we all know that it can cater, or the population in a district would be between 10 lakhs to 20 lakh population. So even in our Karnataka state, we got 4 medical colleges during my tenure. One, I am very happy to say that in my own district, Chikballapur, the same district that you are all present today, it's almost ready now for inauguration, maybe in January. I will request our Honorable Swamiji also to be part of that inauguration by time. So, apart from Chikballapur, we started Chikmagalur, we started in Haveri and Yadgir, which is in North Karnataka, aspirational district. Why I was very much interested to start medical college is also, there is a small personal story. Since I was living in a village nearby Chikballapur, which is about 20 minutes to Chikballapur town, but 1 hour to Bangalore. We didn't have a good secondary and tertiary hospitals in Chikballapur then. I'm talking about 2005, October 29th, where my mom had, massive myocardial infarction, heart attack. So we didn't have time, nor we had logistic support to shift her to the nearest tertiary health center. So we could not save her. So that day I decided, somehow Chikkolapur should get. I didn't imagine then I can get a medical college myself. But I always thought that there should be a good hospital in Chikkolapur. But destiny is such that I myself became a medical education minister. Today I am giving sanctioning medical colleges. So, always divinity decides our course of journey. Coming back to medical education, the role of medical education in creating the good health infrastructure, good health care, service delivery. We all know that medical colleges to establish is a huge investment. It is like, many people say jokingly, it is like feeding a white elephant. Because the investment is so huge. I have seen medical colleges, at least I know how medical colleges are established in US, in West Indies, in so many islands nearby US. They would start off in one building of about say 30,000 square feet, 40,000 square feet, without much capital. But on an average, in India, if you wanted to start all these years, you had to shell out a whooping 500 to 600 crores of money, seed money, to start a medical. So it is such a high capital investment for any private establishment to start. So you need deep pockets. And how do they pay their EMIs if they have taken the funding from the banks? They have to charge it on the students, they have to charge it on the patients that come for their hospitals. That is why, though it is available, though it is accessible, I say that today the healthcare is not as affordable as it should have been. The medical education also, it is not as affordable as it should have been. So our Swamiji, our Satguru has understood this. So last year he decided, I want to start a medical college for only poor people, just like how government can provide a free education. He wants to give the seats, medical education, to the poor people, poor students, bright students, the committed students who come back and who serve the society in rural areas. This is the this is the very good initiation that our Sadguru has taken. And we very, very happily last year, along with our Chief Minister, our Home Minister of the country, we came and did Bhumi Puja for the hospital and medical college. So I am all the more happy because I thought to start off only one good hospital in Chikkolapur, but we are blessed by Almighty. In Chikkolapur we are going to have 2 medical colleges and 2 super speciality hospitals. So as a medical education minister, I began in 2000 February, where after I assumed the charge, in less than a month, we encountered what was not understood, what was not in the planning the pandemic. We encountered such a huge pandemic which we were all taken by surprise, huge surprise. And what was not witnessed in the last 100 years, neither the health systems, nor the doctors, nor the government were aware of how this pandemic would turn out to. And that was the scenario, that was the situation when I became a medical education minister. And our Honorable Chief Minister then, in less than 2 months after going into the COVID, he had another responsibility of a huge health and family portfolio as well. So after a span of 30 years, he gave me an opportunity to serve both health and family welfare and medical education, both the portfolios, and serve the state during the most difficult times of the pandemic. So I thought it is an opportunity and it was a huge challenge for me. With Sadguru and Almighty's blessings, Karnataka, after the second wave, we were judged as the best combating state to handle the pandemic, to mitigate the pandemic in the entire country. We were awarded. This could be achieved only with the support, with the cooperation, with the relentless effort of the entire healthcare department, be it doctors, our healthcare staff, nursing staff, Asha Karyakartas, D group workers. Every person had their role to play. And within that 2 years, I was telling Sadhguru, what we created during COVID was unimaginable. What could not be done in the last 50 years, we could achieve in the next 2 years during COVID. We prepared our hospitals. Just to give you some example of what we did to the infrastructure. We had close to 7,000 or 8,000 beds which were with oxygenated beds, which had oxygenated lines. In a matter of 1 year, from 7,000-8,000, 35,000 beds were linked with oxygenated pipelines. So this is what Karnataka did. And even the ICU, we ramped up the ICU beds to almost 3 times. And the appointments of doctors, we hired and recruited more than 4,000 doctors in rural areas and in urban areas. Today you will not find even one primary health center, which is our structural and functional unit of the primary health services that we have as a model in Karnataka. You wouldn't find a PHC without a doctor today. So that is a remarkable change. Thanks to COVID, we used the adverse situation, and we turned into an opportunity. We never debt during crisis. We were always positive. We were brave. We were trying to understand by talking to all the countries, many health institutions around the world, and understand where this pandemic is going, how best the healthcare can be provided to our people to save more and more number of people in Karnataka and India. Thanks to the decisive leadership of our Honorable Prime Minister, time to time he used to suggest us, time to time he used to motivate all the states. Though there is a federal structure in this country, we have different political parties who are ruling in different states. But as a statesman, our Honorable Prime Minister ensured there is one command for one nation. One same treatment for all 130 crore people. And what vaccination did to us yesterday is a great day of joy, where we celebrated of administering 200 crore vaccine doses yesterday. In a record time of 18 months. Even the most developed countries, they have not been successful in administering even the 40% or 50% of the population. But we have successfully vaccinated more than 90% of the population. Initially when COVID broke out, because of our density in population, because of the status that we are, our status is that we are like a developing nation. So many people thought there could be deaths everywhere. We could witness the deaths, and we can see the dead bodies in roads, in bus stops, near the hospitals. This was the kind of thinking that many people really thought about. But fortunately, with a very aggressive leadership, political leadership, our health systems, our doctors, our all state departments, they work closely, work relentlessly, day and night, to ensure that pandemic is mitigated, pandemic will be defeated, and we saved lakhs and lakhs and lakhs of people today. And today, I don't see any of you, at least 90% of you, without masks. So that is the level of confidence today Indians have, because you are all aware that you are being fully vaccinated. And now we have started the third dose of vaccine, preventive dose also. 75 days, we will be targeting 4.2 crores in Karnataka alone, which is the adult population that we have from 18 years to 59. We will be administering this 4.2 crore doses within 75 days. This is the target. So coming back to the medical education, it is not just the quantity of medical colleges, the number of medical colleges that is paramount. It is the quality of medical education. What do you mean by quality of medical education? See, the emphasis should be on clinical practice, good clinical practice. Similarly, you should have lay an emphasis on research and development. Any medical college should inspire their students, motivate the students to get into the research area, where we are still lacking. Let us agree. Let us accept the handful of medical institutions that are there in this country. Not many medical colleges have concentrated on improving or motivating their students, encouraging their students in research area. They need to publish international material. They need to have a tie-up with the most advanced universities across the country. In fact, today I have requested our Vice Chancellor, Rajiv Gandhi Health University. It is the only health university that we have in Karnataka. I have requested that this university should get a tie-up with all leading universities, medical universities across the globe. And also there should be an exchange program between students and faculty. We have seen today the Oxford University from Britain. They were the ones who came out with the vaccine along with AstraZeneca. So that is what we initially did it. After that, the homegrown vaccine, which is Covaxin from Bharat Biotech. We were the ones we also came out with the vaccine along with UK, that is the Oxford University's vaccine. Moderna from US, mRNA. And yesterday we got the clearance for DRNA, the first DRNA vaccine of Indian growth. This is new India. This is the new vibrant India that we have. So research in any medical college should be really encouraged. That is my take. Secondly, the modern technology, use of the modern technology, use of modern tools, learning tools that we have. This is where our students can get more access to information. Because today, innovation is the order of the day. Today, the medical practice or the healthcare wouldn't move an inch without the engineering innovations. Today, we are seeing robotics. The role of robotics, the role of artificial intelligence, the role of CT scans, X-ray machines, mammographies, everything is technology. If you want to diagnose anything, you need technology. So engineering and medical sciences go hand in hand. So artificial intelligence and logarithms is taking one step higher and forward. We were always talking about preventive medicine, but today we are talking about predictive medicine. So we can predict what exactly can happen to an individual in 2 years or in 5 years based on data algorithms. So there are some countries using their data, they can predict these kind of information, like Israel, like US. Similarly, India will also try to implement this. Karnataka state is a welfare state, and it is a pioneer state in medical education. We have the highest number of medical colleges in the entire country. Today we have close to 1.5 lakh students who study every day, every year in medical education. Medical education is not just medical degrees. You need associated nursing education, allied sciences, paramedical courses. You need a quality education in these areas also. Without their support, only doctors can't do anything. In the entire world today, there is a huge demand for good nursing care, good nurses, especially Indian nurses are in high demand. So, if you need to produce good nurses, you need to have a very good nursing education. Similarly, allied sciences. We have also Ayush education today, which is the traditional medicine. Traditional medicine is as old as our Vedas, right from Ayurveda, Unani, Siddha, yogic sciences. These are very, very old. And today there are many colleges which are mushrooming in this state. And I am so happy that people are believing in traditional medicine. Not just the students, and also the people of this country. They are going back and they are believing in their system of traditional medicine. But only my piece of caution to them is, they should document with research, they should document it, they should publish it, because every belief, because you just can't believe a medicine unless there is a proper research, proper publications, proper documentation. And there should be a standardization. So, the traditional medicine also, to promote the traditional medicine, Karnataka, last year itself I proposed a bill to establish a new Ayush Autonomous University in Shivamogga, Karnataka. This last year, last session, the legislation was passed and will be establishing the Ayush University also. So I am very happy today, Swamiji, today has selected the right subject, because this is the timely subject. Today, post-pandemic scenario, nobody knew couple of years ago that we will come out of pandemic so quickly, because we had lockdowns, work from home culture, lot of our companies were shut, lot of our businesses were shut. It was really disheartening to see people who were street vendors, vegetable vendors, the working class really suffered a great deal. But thanks to the advancement of the health sciences through vaccines, today we have considerably beaten this COVID pandemic. So the medical education, the healthcare go hand in hand. We want to develop the best primary, secondary and tertiary healthcare across Karnataka. And today we are talking in certain disciplines, even the quaternary healthcare services also, like in mother and child, because we want to bring down the infant mortality rate, we want to bring down the mother's maternal mortality rate, MMR and IMR, should be, the number should come down to what WHO has given us the target. We have to meet those targets. That is why I said it is not just how many colleges, how many hospitals we have, and how many doctors we have. We had one doctor for every 1,700 or 2,000 people way back, 2 decades back, about 20 years ago. But today, as WHO wanted one doctor to 1,000 population, today we have surpassed that target and we have one doctor to 700 people in Karnataka. That is the achievement. So, as there is availability, as there can be accessibility, affordability should be the immediate target of all of us, and the state governments, we should all properly plan things. We should come together. Always Swami says, government and organizations like Satya, which is a selfless institution, and some private sector, we should all come together. It has to be a partnership between the people and the government for any venture, for any progressive outcome. We have to come together, and that is the way forward. I look forward for greater participation of the like-minded people to progress in medical education, to progress in healthcare, so that the last person, the last mile of this state and this nation is connected through a quality healthcare services, which is his right. In my opinion, right to health is a fundamental right of human values, human rights. So this fundamental right should be given to the common man, as our Honorable Prime Minister always says, Sabka Saath, Sabka Vikas, Sabka Vishwas, Sabka Prayas. So with all our efforts, let us strive hard to make this nation greater and greater. Thank you for the opportunity. Namaste.
Dr. Sudhakar has been associated with our healthcare mission, especially here, right from the day one. He did the Bhumi Puja of the Sarla Memorial Hospital way back in 2017. Recently, when we upgraded the hospital with oxygenated beds, and he came again, brought the Chief Minister, made him understand the work that we are doing. And today, within 6 months, thus the data of 6 months says around 80,000 patients have been treated, 2,500 surgeries have been performed in this very facility, and all for free. Absolutely no charges to anyone. Where healthcare was free. That's why Vaidyo Narayana Harihi. Because doctor was like God, doing selfless work without charging anybody anything. Whatever people gave out of Shraddha was enough for that doctor. Teachers were gods, because they taught without expecting any returns. Now if healthcare education has to come together, two gods have to come together, the teaching and the doctor. Right? So we have that kind of a system coming up, and Dr. Sudhakar is aware. It was his dream that in Chikbalapur we should have a super speciality hospital as well as a medical college. He, as a boy from the same district, who grew up, struggled his way to get a medical education, and now with his hard work and the vision, just now he shared the understanding and the vision of the healthcare in Karnataka. It was so impressive, it was so comprehensive, so clear. It was so well articulated also. I'm very, I would say Karnataka is blessed to have a health minister who thinks like this, especially health and education minister both. We need such visionaries. And he's not only visionary, he's a man of action also. I've seen him work through the COVID pandemic, and I've seen how quickly Karnataka rose to its feet and did everything possible in its might. And there's no surprise that it bagged the award for managing the pandemic in the best way in the entire country. And today we are all seated in this hall conducting such programs. It's possible because of the hard work, right from the government to the last person on the street, the D group workers, who worked very hard through the pandemic. Oh, this is our country. Sarve bhavantu sukhina. Let everybody be happy. Sarve santu niramaya. Let all be healthy. That is the vision. And in few months from now, and Dr. Sudhakar is very much aware, he was there when Bhumi Puja for the new big hospital, 400 beds is being done. But I do not want to wait for that whole hospital to be ready. I want to start the medical college with the existing facilities, which he has very kindly, he told me that I will take the bill to the parliament. It will be my privilege to take this bill. I often read the newspaper and see how many efforts they're putting, and I keep telling our people, whomever I meet from Karnataka ministry, that Karnataka is poised for a great big growth in this decade. This decade belongs to Karnataka. It will do well in every sphere: economic, industry, education, healthcare, social sectors. Under their leadership, it will do very well. It will become one of the star performance as a state in the whole of the country. That is given. And also good work, hard work, leadership is good. I'm sure this will be achieved. I only look at the other side of the segment. The nicer part is that economy, industry, manufacturing, services, employment. But the rural side of the Karnataka also needs a lot of attention, which now they have started working towards it. As I said, for many decades it did not happen. Now it's happening. And in times to come, when the medical college is ready here, I'm sure like Ganga Yamuna, Chikbalapur Medical College and our medical college will serve the entire humanity, not just Karnataka, but the whole world. Let it come and benefit from the services of these hospitals.